Welcome to episode 54 of Strong Women Over 50.
Hi, I'm Chris. Welcome to the podcast for the Becoming Ellie community.
And I'm Jill. What is the Becoming Ellie community? We're women over the age of 50 who are interested in being fit and strong.
If you're curious why we're called Becoming Ellie, it's because Ellie was the goddess of aging in Norse mythology. She defeated Thor in a wrestling match, and Jill and I decided we wanted to be fit and strong like Ellie.
Feel free to check out the Becoming Ellie website for more information. You can find it at becomingellie.com.
And you can also find us on Facebook, Instagram, and Twitter. If you're on Facebook, we have a private group for the Becoming Ellie community. Please join.
So, Chris, today's guest is someone I've known for a while, Joanne Hagy, who is a massage therapist, and I'm really looking forward to our talk with her.
Yeah, I love massages, and I'm eager to hear what she has to say. Let's go to the podcast.
Today's guest is Joanne Hagy, owner of Orthopedic Massage and Wellness in Hudson, Ohio. Full confession here. Joanne has helped me deal with some really intense pain, so I'm a big believer in what she does.
Joanne has over 20 years' experience in massage therapy as well as sports medicine. She spent the first 8 years of her career working in an orthopedic physical therapy clinic as an athletic trainer, soon combining massage therapy into her treatment protocols.
She then solely began focusing on her massage practice and teaching massage, where she was co-owner of the School of Orthopedic Massage and Bodywork in Ann Arbor, Michigan, for 4 years.
She has since relocated to Hudson, Ohio, in 2014, where she resumed a successful massage therapy practice. Welcome, Joanne. We're so happy to have you with us today.
Thank you, Chris and Jill. It's great to be here.
Yes, thanks for joining us.
Thank you.
Joanne, can you tell me what is orthopedic massage and how is that different from a regular massage?
Sure. So orthopedic massage tends to be a generalized term. It's kind of an umbrella term where you put all your other modalities underneath the umbrella. So it's not really one specific massage technique. It's more of integrating a lot of different techniques into one session. So somebody might have hip pain, and you need to evaluate, see how their body alignment is, assess it, and then you give the massage, which is appropriate.
I see. And a regular massage, what do people consider a regular massage?
So a lot of people would think of Swedish massage, a place where you would go to the spa and somebody would get like a full body relaxation.
Okay.
Often that's what people think of a general massage is.
Gotcha. Okay. Thank you.
So the orthopedic massage can encompass myofascial release, neuromuscular therapy, sports massage. So there's quite a few things that you can add into that spectrum.
Yeah, that's very different, isn't it?
It is.
So your website also mentions therapeutic massage. Is that different, or is that just, if you could explain that to me?
Yeah, so therapeutic massage is somewhat similar to orthopedic massage. I believe the therapeutic massage offers more of an intuition, insight, healing sense that comes with the massage. There's compassion, nurturing, concern, and trying to connect everything with a healing touch, where orthopedic massage is a little bit more scientific based.
Oh, okay.
I didn't quite realize all of that. I guess there's a lot more to massage than, what meets the eye. I'm wondering, how did you get started? Like, what motivated you to become a massage therapist?
Well, that's an interesting story. As my parents would tell you, when I was in utero, my dad would massage my mom's belly every day.
Oh,
so you were born with it.
Exactly. And as growing up, we would trade foot massages or neck massages. I like to call my parents hippies. I mean, they were kind of ahead of their time. with composting and recycling and really into kind of a holistic lifestyle. I was always very athletic and had an injury in high school, which actually led me down the path of sports medicine. During the sports medicine lifestyle, I realized that working a 9-to-5 job was wonderful, but when I wanted to have children, it probably wasn't very conducive not to be available to my children.
Sure.
I decided to go to massage school, and I was able to incorporate a lot of soft tissue work while working as an athletic trainer, and pretty much just fell in love with healing the body when there's injury. Yeah.
Okay. So you worked in a physical therapy clinic before you went into massage. Is that what you said?
Yes.
So, and did you work as like a physical therapist? Did you do personal training, or what exactly?
No. So an athletic trainer in college branches off different from exercise physiology, which what a personal trainer would have.
Right.
So sports medicine, you're basically the people on the sidelines when the football player gets hurt, you run out, you do your assessment, and you bring them off the field, and you're responsible for their rehabilitation.
Okay.
So you learn orthopedic assessment, which if somebody has a torn rotator cuff, we can evaluate that, and then we come up with the treatment protocol of exercise to get them back to playing in their athletics.
Oh, I see. It's like after they get hurt.
Yes.
As opposed to like a personal trainer that works with you when you're not hurt, like, well, to...
They're the ones who get, well, I don't want to say they're the ones who get you hurt.
That's why I kind of stopped talking. They don't get you hurt, but
That's right.
After you've injured yourself.
Yeah, well, we're kind of the first responders, and then we take them through the rehab protocol.
Okay, so then that makes sense then, so that when you began to introduce the massage into that practice, you were already dealing with people who were recovering from injury of some sort.
Exactly.
And so the massage focuses on soft tissue? Is that what?
Yes.
Okay, well, which makes sense. So the massage really works in tandem with things like physical therapy and whatever else a person might be doing to recover from an injury.
Correct.
Okay.
Correct.
So that sort of leads up to my question, which is, what are the benefits of massage?
Sure. So there are actually quite a few therapeutic benefits. It promotes health and wellness. Physiologically, it decreases your heart rate, lowers your blood pressure, improves your circulation. Your immune function actually increases quite substantially. Reduction of stress, anxiety, improves your mental alertness. Obviously, it's going to relax your muscles. It improves your posture, and it helps to optimize range of motion.
Wow, all that.
And there's a lot more when you look at pain management, prevention of injuries, as well as recovery of injury.
Oh.
So what kind of massage doesn't help?
So if somebody has a specific injury or pain, some chronic pain,
okay.
If you just get a Swedish full body massage, it's really not going to address the tissue to help with that.
I see.
So you might feel better because you're relaxed, but
Sure.
It's not going to really address the issue.
Exactly. Because I believe when somebody comes to me and I'm working with them, I'm kind of looking at the body holistically, and there's a balance between the front and the back. Different muscles have different patterns of strain, and injuries and bad posture can lead to chronic problems. So I'm going to work to address that.
Okay. So are there things that you should not use massage for?
That's a very good question. There are certain contraindications as far as landmarks on the body. You're not going to massage somebody's throat per se, their armpits. You want to be very mindful of skin diseases. As a massage therapist, you're kind of actually helping people monitor moles and if things look different or change along their path.
Right.
You know, there used to be documentation that said you don't really want to massage people with cancer, and that's been debunked. So I really haven't come across too much where you wouldn't think that massage would be useful.
Okay. I met someone at the gym who she was diagnosed with skin cancer, and she said it was the person who was giving her a massage that
Noticed it. Yeah.
that noticed it and suggested that she go see a doctor. And she said she was so grateful because it was in a spot where she really couldn't see it.
Yes.
Wow.
It's very powerful.
Wow, I bet.
How often do you think we should get a massage?
Well, that really is very personal. First of all, it's a financial thing. There's some people who can't afford to get massage as often as they probably need to. I believe once a month is a great protocol. Often I'll have people come once a week, bi-weekly. But if finances are an issue, if they can come in every 8 weeks, that's great.
So whatever you can afford.
Pretty much.
That's what it sounds like. Well, and I guess it depends how badly you hurt.
That's exactly it. What's your severity of your condition? How long have you had it? Or do you just need maintenance?
Mm-hmm.
You know, there's a lot of us out there who are weekend warriors, and you know, we're pushing our bodies beyond the limits. And as we get older, we don't recover quite as fast.
Mm-hmm.
So the massage really helps with the recovery. If you can get regular massage, it's going to actually help in that maintenance part of it.
Right. That makes sense.
One thing I've noticed is, well, I know like years ago, I had a massage person who I was dealing with TMJ, and she said, "Oh, I'm certified in that." And she did some massage thing, and it really did help, but it was painful.
Yes.
And so that's one thing I've noticed is that, you know, massage is not always just relaxing or a feel good thing. It does sometimes kind of hurt, or
Yes.
it can be painful. Why is that? And is that okay?
It is okay. So this is where we have to find the balance of what's a therapeutic touch and what is too much or too little. So if the muscle is in a dysfunctional state, it can actually be too tight.
Mm.
The approach to the treatment does not have to be painful, but the more dysfunction the tissue is, it will be tender.
Right.
But nobody should really walk away from a massage bruised or felt kind of like they were beat up. I always say, then you got bulldozed. That is not normal.
Okay.
Can you tell when you're giving someone a massage, where they're tender or where the muscles are sore or?
Yes, I can. Yeah, usually each muscle has a fiber direction, and when there is a trigger point or an area where the muscle is actually hypertonic or too tight, it feels different.
Mm.
And that comes with the more dysfunctional tissue you touch, the more sensitive your fingers are to notice those spots.
Is it sort of like a knot?
Not always. Sometimes it's what we would call an end feel. So tissue can be very spongy. It can be kind of gritty. Like if you've ever touched something and it felt kind of gritty, it can be squeaky, or it can be very firm. And there's levels of firmness that kind of can let you know if a muscle is tender or not to the client on the table.
Okay.
Interesting.
Yeah. And this is kind of where a lot of people say they want deep tissue massage. We see that a lot in advertising of massage therapists. And I don't really believe there is such a thing as deep tissue massage. I believe there's specific massage. So if somebody comes in and says, I want deep tissue, they may have a misconception of wanting that pain that comes with it. And I don't believe a massage needs to be that painful. But if you're getting very specific, that can be tender and uncomfortable.
I see.
And Jill, with your TMJ, those are tiny muscles.
Right.
So those tiny muscles can get a little bit more painful because they're just not enough surface area to warm it up nicely and to have it release as nice.
I worked at a place where we had massage offered at work, which was wonderful. It was like the best thing about that company. But it just sort of came up that she said, oh, I've actually trained to do this and I'd be happy to help you. And I went, when I first started, I think I went once a week, and then we went to sort of maintenance things. And when she first started doing it, it was painful. And she knew it. She was, so I'm not complaining because it really did help. It was amazing. And so what was amazing to me about it was whatever I paid for her services was a drop in the bucket compared to what the dentist had wanted to do for me and to make appliances and things for me. So, and it worked. It worked really better than anything I had ever tried before. So that was a sort of an early on of my belief in the power of massage. That was just an eye-opening experience.
Oh, that's fantastic.
But it was very sore.
Sounds painful.
It is very painful.
Well, one of the hardest things is to try to find a good massage therapist. And so I'm wondering, how do you think people should go about trying to find one in their area? Our listeners are all over the world. So I'm wondering, are there certain questions that they should ask, or how should they go about it?
Well, and it becomes very individual. So if somebody does just want that relaxation, the kind of take yourself away from everyday stressors, there are a lot of massage therapists that do full body relaxation. Those are pretty easy to find. And the trick starts to come in is when you need therapeutic work. And how do you find somebody who knows the techniques that I have talked about with orthopedic massage? Do they know how to do neuromuscular therapy? Do they know how to do myofascial release? If you're an athlete, do they know sports massage, and can they help you with your planning of your athletic events if you're running a marathon or doing a triathlon? Mm-hmm. There are a lot of intricacies there that you have to actually interview those therapists. And a lot of it is a learning curve.
Yeah.
Hopefully nowadays, a lot of massage therapists have a website. Then, you can kind of look and see what types of massages they do. If you need therapeutic work, I would stay away from people who focus on energy work, Reiki, polarity, those types of things, because that's all very good massage, but it's not a therapeutic type of massage. Mm-hmm. In the United States, we have the American Massage Therapy Association, and online they have Find a Massage Therapist.
I'm sorry, what was the name of that?
American Massage Therapy Association.
Okay.
And online, you basically would put in your zip code, and it will list all of the members that are part of this association. And you can kind of look and see, well, what types of massages do they do? When are they available? Can usually list like their hours available, where they work. Do they work in a chiropractic office? Do they work in a massage clinic? Do they do home visits? And then you kind of have to assess that to meet your needs and goals.
That's a good way to kind of narrow it down and also define what questions you want to ask. That's good. Thank you.
And actually, you want to know the best way to find a massage therapist?
What?
It's word of mouth.
Is that right? Ask your friends.
It really is. Mm-hmm. Ask your friends, because often it takes a lot of different therapists to find somebody that works well with you. I myself, when I moved to Ohio, I was getting massage every other week. And I get to Ohio and I couldn't find anybody that I liked for a massage therapist. So it takes time, even when you interview people, and even though you know what you're looking for, sometimes you just have to keep trying.
Yeah.
I guess that's like every service, when you're trying to find someone who, that comes down to whether it's your doctor, your dentist, a massage therapist, physical therapist.
Yes, hairdresser.
Yeah, everyone.
Right.
It really comes down to having that. So the same thing about being a doctor and all. Those are very, in some ways, intimate relationships, in that people are allowing themselves to be in a very vulnerable position with you.
Correct.
So they have to be comfortable with you.
Right.
And you have to be comfortable with them, I assume, too. But that's probably what makes it a little more challenging.
Right. There's a lot of trust.
Yeah.
Absolutely.
I hadn't really thought about it that way, but yes, you are talking about, okay, especially when you haven't met someone before and, you go in and it's like, okay, I'm going to take my clothes off and lie on this table.
That's right. And a lot of massage therapists, they still work in their homes. And are you comfortable with going to a home office, or therapists that are in a chiropractic office? And is that more comfortable for you? In those cases, some of those people do not have websites. So that's where the word of mouth comes in. Who do you go to? Well, I don't know. Well, who do you go to? And you can find people that way.
Okay. So if you are an athlete, if you are running races or doing triathlons or something, it's probably a good thing to ask fellow runners or triathletes. Who do you use?
Exactly.
People who are really running a lot of triathlons and races probably have at least someone they can recommend.
Yes.
Yeah, I would think that, the more intensity in your exercise program, the more important it is to get a massage.
Exactly.
And probably as you age too, with women over 50.
Absolutely. As we age, there's arthritis that starts to sneak in. We might have some limited range of motion. We might have tendonitis or bursitis. And we need to find somebody that can help and give us some guidance on how to take care of ourselves.
As many of us, as we age and struggle with staying fit and strong, how should we be embarrassed about our bodies when we go see a massage therapist?
Absolutely not. So when I work, I am very anatomy oriented, as far as I like 3D image your muscles. And so my intent is to work the muscles. Some people are like, oh, I didn't shave my legs today. Oh, I didn't shave my armpits. I never noticed that. It doesn't even cross my mind. We all struggle with 5, 10, 20 extra pounds. It doesn't even come up in my mind as a therapeutic massage therapist.
Okay. So someone shouldn't say, I'd love to go have a massage, but I weigh too much.
No, not at all.
Or I don't want you to see the scars that I have from various surgery or what have you.
Yeah, that's our own insecurities, and I think we all have them, but I don't notice them. So I hope people would understand and kind of trust in their therapist.
Right. Okay. Before we go on any further, I want to go back and ask you something that you said earlier. You talked about doing the myofascial release.
Correct.
And I didn't really, when you were telling us what you do as part of orthopedic massage, I didn't really ask you in any detail about what that was you were saying. But can you tell me what myofascial release is?
Sure. So myofascial release. So myo means muscle, and release is the releasing of either a muscle that's either too tight or a muscle that is actually elongated. So based on our anatomy and our structure, each muscle has a strain pattern. It's either concentric, which is tight, or eccentric, which is elongated. So take something like our pelvis. Our pelvis moves, it rotates each side, right and left, and the attachment of the hamstring is onto the pelvis on the ischial tuberosity. And then the other attachment is onto the tibia and the fibula of the lower leg. So if the pelvis starts rotating forward, the hamstring becomes too long. It's actually in an eccentric contraction. So somebody says, go stretch your hamstring. You can't stretch it any further. So somebody will say, well, my hamstrings aren't flexible. So during a myofascial release, if you release the fascia, your pelvis will rotate into a normal position and the muscles will contract normally. They won't be either too long or too short. So the actual technique is almost like a stretch. It's very slow and it is very intentful on transforming postures. Does that make sense?
Interesting.
It's a little benign.
Yeah. No, I think that makes sense.
So
Right.
It's more of a lengthening of the fascia.
Okay.
So when someone says they pulled their muscle, does that mean their muscle has elongated, that it got pulled too far?
Sometimes. Also, if you pull a muscle, its instinct is to contract too much.
Oh,
So it can actually be both.
I see.
A pulled muscle is basically varying degrees of how much the tissue has been injured. Their levels of injury. But know that if somebody says I threw my back out, that is a multi-dimensional
Right.
type of treatment. So it's not just the back. That's where we feel it, but we really have to look at everything from the ribs to the knee.
Yeah.
On both sides.
Okay. So you've done something somewhere, but it may not actually be in your back. It's your back that's sore, but it may not be what's causing that pain.
Correct. And that's where we look at trigger points.
Okay.
They have mapped out trigger points, and each trigger point within a muscle can radiate and give you pain elsewhere. If your muscle, your supraspinatus of your rotator cuff, which is the most common rotator cuff muscle that gets torn, never really hurts where the muscle is, it always gives you pain into the arm. So that would be a referred pain pattern.
Okay. So if that happens, then all a person knows is my shoulder hurts or my arm hurts.
Yes.
And they make their way to you and you're able to help them figure out what actually has gone wrong.
Exactly. And there are over 19 muscles that move the shoulder. So how do we know it is not coming from your spine, your shoulder blade, the actual arm, or the neck? There's a lot of components involved, and it's my job as a massage therapist to balance the muscles pulling on each side.
Yeah, it would be difficult as an individual to even say exactly where it hurts,
Yes.
when, especially shoulder pain. I don't know. I guess I say especially shoulder pain because I've had shoulder pain. And then any kinds of pain, because, back pain is the same way. It seems like it moves sometimes,
It does. And neck pain,
Right.
A lot of neck pain can lead to headaches, and it goes into our head. But did it start in our head or did it start someplace else?
Sure.
Do you think any particular sport or activity is more likely to cause injury?
I think more of the contact sports. Hopefully, as we age, we're getting away from those types of contact sports.
So I shouldn't take up football.
No, let's
MMA.
not do any roller derby.
No rollerblading?
No roller derby. We can
Okay.
stay away
Rollerblading's
from that.
probably okay. It's the contact with the ground that hurts. Yeah.
That's exactly it.
Oh, yeah, rollerblading would be okay. It's the roller derby that I was thinking.
Right.
Yes.
Yeah. Where you knock each other down.
As we look at running, we're very upright, and injuries occur with running from overuse. So is it something with your form? Is it something with your shoes? Is it something with the terrain? Is the road cantered? So those are things as a massage therapist that I would be asking my client, why are you having these pains? The knee pain may not be arthritis. It might be you just have some alignment issues. And the same thing with cycling. Think about the position the body is in when you're cycling. We're bent forward and we're bringing our knees and our hips up and down repetitively for miles and miles. Well, we have a muscle through our stomach that's attached to our spine called the psoas. Mm-hmm. When you activate the psoas too much, you will have trouble standing upright. That muscle gets into a contracted position. So you get off the bike and then you're like, oh my gosh, I'm so stiff. My back hurts. Well, you really didn't do anything to your back. You affected the psoas muscle.
That's interesting. Yeah.
But, you get into things like tennis. You could twist an ankle or sprain an ankle. There's a lot of side-to-side movements that could aggravate a knee. Tennis elbow, shoulder issues. So there are a lot of things we just need to be mindful of when we pick a sport as we get older and don't heal as fast as we did in our 20s.
Well, do you have some advice for us to avoid injury? Women over 50, like I know some people like to do stretching before they exercise. And
sure.
I've heard sometimes that's good, sometimes that's not. I mean, personally, I like to warm up before I exercise.
Absolutely.
What's your thoughts on that?
And research has changed quite a bit over the years as far as stretching and warming up. I believe we need to do movements in a dynamic fashion. So you're doing a dynamic warm up where you're doing a lot of things with some range of motion. You can hold stretches a little bit, but if your muscles are cold and you hold a stretch, that could actually cause little tiny tears. So you kind of maybe do a quick little jog before you stretch your quads. Just do some circles with the shoulders if you're going to go play tennis and kind of move around. I think more importantly is doing some stretching and self-care after your exercise.
Right.
And that can be stretching. It can be foam rolling. It could be the use of a lacrosse ball.
Okay. Yeah, I really like to foam roll. I have a couple of those and do that pretty religiously. Yeah.
Yes.
What do you think we should be doing to be fit and strong as we age?
Definitely, we need our exercise. We need our stretching. And I do believe if you like to run or triathlon or cycle, we have to also add strength training into it. We need to make sure as we get older, we have the muscular strength so we don't get injured. We need to balance the body with our strength as well.
Everyone says we need to be doing strength training.
Yes, everybody, even me.
Yeah, well, that's good. Thank you.
Yeah.
So cardio of some kind?
Yes.
Running, bicycling, whatever, and throw in some strength training.
Exactly. And it doesn't mean you need to be powerlifting or, CrossFit or any of that kind of stuff. Take some time, do some lunges and some squats, just some basic arm range of motion with some weights. I think often we get kind of caught up in what is the next greatest thing. Do we need to be doing CrossFit? Do we need to be doing heavy weights with light repetition? And realistically, we need to do something we enjoy. It can go back to basics.
Yeah. What do you personally do to stay fit?
Well, I like to run. Used to do quite a few half marathons and 10Ks, but have kind of gotten out of that. So my goal this year is to get back into doing that. I lift weights and do body weight exercises about 3 days a week. And then I do my cardio, whether it's an elliptical or the treadmill during these gloomy Ohio days. And then when spring breaks, I like to get out and get running.
Yeah, outside. That's always nice.
Always.
Maybe we've sort of talked about this, but when we're doing all our working out and exercising, why do we get injured after we're doing that? what are we missing, or what are we doing that we shouldn't be doing?
So sometimes what happens is we go back to the muscles are either too tight or actually too weak. So it goes back to balance. We're not real good at balancing our body muscular wise in the world we live in. Everything is very one-sided. We get in the car and everything is with our right foot. That's the accelerator. That's the brake. So we use that much more than the left side. So those muscles will start to tighten up. Back in the day, we used to drive stick shifts. So we had kind of an equal motion. What we do in our everyday life, which is our perpetuating factors, we sit at computers, we look down at our phones, and then we decide we're going to go exercise, and we're kind of recreating those same muscle problems. We're doing a chest press, but didn't we just sit at a computer all day with rounded shoulders forward? So we need to readdress the opposition of the muscles. So the upper back and the back of the shoulder, and actually our whole core needs to really be addressed, because that's usually where we're going to get injured. Something with our back, our hips.
So that's the core.
That's our core. That is our core. And I think of the core from the ribs to the knees.
Okay.
Because you really can't dissociate your quads and your hamstrings, because those attach to your pelvis. And then the muscles of your pelvis attach to the femur, and the muscles of the back attach to the spine, to the pelvis. So it is all one area. Your abdominals, your psoas, your QL. I could give a really good anatomy lesson with all these muscles. But
it's basically your ribs to your knees.
Ribs to your knees.
Yep.
And I think that's why in exercise, when we start dealing with our core and our abdominals, we don't just focus on doing crunches anymore. Mm-hmm. We're doing very dynamic exercises that we have to engage our core when we're doing a lunge and when we're doing a squat and side lunges and those types of things. And it takes our brain power to recognize that. And that's where it comes in is, if you don't know what to do when you're exercising or lifting weights or stretching, hire a personal trainer. Get 5 or 6 or 12 sessions in where they can teach you the necessity of not injuring yourself if you just go in and do it all by yourself.
Mm-hmm. That's really good advice.
Yeah, good advice.
I want to go back just for a minute. You said something about arthritis, and that's for some people it's kind of inevitable that some arthritis is going to come about. And as a massage therapist, how do you work around that? Or does it help to get a massage when you do have arthritis, or does it depend how bad it is?
Yeah, good question. It does depend on how bad it is. Often, once you have arthritis, you have bone on bone. Mm-hmm. And that type of pain is probably the number one level of pain with our body. We can deal with muscle aches. We can deal with nerve pain. But when the bones start touching, that really is very difficult. And what I do with my clientele, if they believe it's arthritis or they've had x-rays, I honestly think knee replacements, hip replacements, even shoulder replacements are really beneficial, especially if you still want to remain active, because you are going to lose range of motion when you have bone pain. Now, if it's in the very early stages of arthritis, massage is great. Mm-hmm. We can balance the body. So maybe the right side's not doing as much as all of the work, and we get the left side to get incorporated, and it can take some stressors and strains off of our joints, because we're basically made up of levers, and kind of the bones are our stable foundation. It's the wood in the house, and our muscles are the siding.
The muscles are the siding? Okay.
Yeah. It's encompassing.
It's not the
all
insulation,
wood
I guess.
Not-
Oh, that's the fat.
That's right. That's right.
Oh.
Well, how about if we switch gears here for a second? I know it's not your professional area of expertise, but do you have any advice on food? I'm kind of wondering what your thoughts are.
Well, for somebody who's probably tried every diet on the universe, I really think portion control, logging your calories really will make a difference if we're trying to maintain our weight, lose weight, or gain weight. We got to know what we're intaking. And I think a lot of times we just overestimate our portions. I'd like to think that no food is considered a bad food or, oh, I can never have that ever again. I think when we limit ourselves, we're going to be more apt to quote unquote cheat. Mm-hmm. But, there are fads. There are things that people are going to do. They're going to restrict certain foods. Personally, I have celiac disease and I cannot have wheat. So does that mean I'm never going to have pasta again? No, you just have gluten-free pasta. I still have gluten-free bread, but you can't eat a whole loaf of bread. I wouldn't do that if I had it or didn't have it.
Right.
You just have to be very mindful. And really it is portion control, and you can't out exercise your diet. Know that from firsthand.
Yeah.
Yeah, you just get hungrier.
Yeah, you really do. But, we do need to intake half of our body weight in ounces of water daily. I do believe a lot of us are dehydrated.
Half of our body weight in ounces.
Yes.
Mm-hmm.
So if you weighed 150 pounds, oh, so that would mean that would be like 75 ounces?
Correct.
Okay.
Yeah.
I was thinking, how am I going to convert all those pounds into ounces? Okay. I'm making it a little more complicated than it needs to be.
Yeah. So
okay.
somebody who weighs, 125 pounds, they don't need 8-ounce glasses. That's too much. So,
mm-hmm.
When they used to say you need 8-ounce glasses, but somebody who's 250 pounds, that's not enough for them.
Right.
So it does give you a nice formula if you just take your body weight and divide it in half.
All right. Do you have a favorite recipe or a go-to meal for a busy night?
That's a good one. We end up usually doing veggies, usually broccoli, mushrooms, and red pepper. And we will just pan cook some chicken, cut it up, put the veggies in, and then put it over rice.
Oh, okay.
That's my real quick. Yeah. And whatever seasonings you want to add, if you like a little Cajun or if you like a little all seasoning, you can mix it up.
Yeah, that sounds good. So broccoli, your veggie, normally broccoli, mushrooms, and red peppers?
Yep, red peppers. And
saute them.
Nice color.
And then mix it with the chicken and put it over rice.
Exactly.
That sounds good.
It does.
And easy.
Very easy. Very quick, too.
Yeah. We have gotten to the lightning round, and those will be quick, short questions, and then it can be a long or short answer, whatever you want. No right or wrong answers.
Got it.
Planks or burpees?
Planks.
Run or bike?
Run.
Zucchini or butternut squash?
Zucchini.
Vegan or paleo?
Paleo.
Gym or park?
Gym.
Okay.
Salad or sandwich?
Salad.
Treadmill or elliptical?
Oh, equal.
Okay.
Wine or beer?
Wine.
Okay.
Kettlebell or dumbbell?
Dumbbell.
Quinoa or rice?
Rice.
Coffee or tea?
Coffee.
Mm-hmm.
Bread, yes or no?
No.
You already told us, didn't you? Yeah.
Yeah.
Okay.
But
Yeah,
it's still good.
Yeah.
Moderation.
you can't have it. You have to have the gluten-free bread.
Exactly.
Well, there's so much improvement on gluten-free products now
Absolutely.
So if you could give your 30-year-old self some advice, what would it be?
It would be take more time for yourself and not focus on trying to fix anybody else. Focus on fixing you.
Oh, okay. That's good advice.
Now, here's a question for you. As someone who sees an awful lot of bodies, how do you define fit?
Wow. So that's a good one. Fit to me is somebody who has a commitment to bettering themselves, whether it's with working out, running, taking care of themselves with massage therapy. That's a fit person. You know, they have enough of a balance that they're taking care of themselves.
Nice.
Okay.
Really appreciate you coming on our show today. And I was wondering if folks would like to reach out and contact you, how can they reach you? Like online, at your website?
Probably on my website, which is orthopedicmassageandwellness.com.
Okay.
Anybody can send me an email or a text. Unfortunately, my calendar is very, very full, so I'm not taking any new clients.
Okay.
But there's always possibilities of adding some people along the way.
Well, some of our listeners may just want to ask you for some advice or question,
I would
or
love that.
I'm sure they might like to just be able to reach out.
That would be great.
Thank you so much for spending the time and answering so many of our questions. I've really learned so much about orthopedic massage.
Well, thank you.
Yes, thanks, Joanne. This has been great.
Yeah, thanks, Jill. Thank you so much. You guys have a great day.
You too. Thanks so much. Bye-bye now.
Bye-bye.
Bye. That was a great conversation. Joanne shared lots of great information with us. I especially liked how she explained the differences in the different types of massage and what she does to help overcome injury.
Yeah, she had some great ideas on how to find a massage therapist that really matches with your needs as well, too. And I thought that was very helpful.
Yeah, I agree. So massage is a great tool to have available, and I think it's a good thing to add into the whole mix, with stretching and rolling and all the other things we do. So I think if you can add massage in there, that's a good way to go.
Yeah, I'd like to hear what our listeners have to say about massage or what they're doing to help to release their stress and also when their muscles get really tight.
Yeah, if you have anything you'd like to share with us, please leave a comment on the Becoming Ellie website or on any of our social media locations. I'd love to see a Becoming Ellie Twitter conversation start up about massage.
Or feel free to call us and leave us a voicemail message. You can reach us at 330-970-6662.
Thanks for another interesting episode, Chris. I always enjoy our talks.
I sure do too.
See you next episode. Bye for now.